and that will be this month. So we'll be doing a monthly podcast and looking at new articles and trying to advance the, Peds profession.
Fantastic. Jenna just gave everybody a preview on what she's talking about and the pediatric review with the Pharmacy Podcast Network that is going to be a monthly show that Jenna jumps into all kinds of excellent things and does a deeper dive on those. But that's what this episode is sponsored by. We'll hit the reel, and Jen and I will get rocking and rolling on another exciting episode of the Perfecting Peds Show. This one all about medication safety during pregnancy. And Jen and I had a good laugh before we started this, and we'll pull you guys in. All right, Jenna. So we started this episode with Kevin running behind on another thing and Jenna getting pulled into some exciting kind of talks with her clinical world that she lives in.
Yes.
Started pulling some graphics together on medication safety during pregnancy. And then you and I both laughed after we pulled up this one. I'll share it with the screen so folks can be clued in.
Yeah.
So here's our, right?
Yep. So Kevin shared me this list and he's like, what do you think? And I was like, looking at it, I was like, I actually hate it. Some of these meds I would not actually recommend to a pregnant woman. So we're going to just go through, we could talk through why some of them I don't like it, but we're really going to hit on the major topics. I think, you could do this, you could divide this in multiple segments, but I think a good thing is to really start with, we spoke about the preconception and all the things to think about. But I think once you actually take that pregnancy test and you're like, oh my God, a lot of my friends have texted me like, I had a huge bender. I was out drinking, and I just took a pregnancy test. Is this a big deal? No, but make sure that once you're early pregnant, sometimes you're so early and it's so unplanned that all you can do is just start from where you're at, right?
Yep.
Because real life, I know with my third, she was definitely not planned. So I wasn't even doing any of the things I just said. I had once you take that pregnancy test, we do not want you to have any alcohol, any nicotine. We want to make sure you start that prenatal vitamin right away because that folate acid is super important in that first trimester to prevent spina bifida. And then caffeine intake. I literally could be like this spokesperson for Dunkin' Donuts. And I'm such a snob. I've literally have tried so many make your coffees at home and I just need my Dunkin'. So I understand. I know if I was a snob, it'd be Starbucks. But so I with myself even, I have to keep myself in check. Right when I took that third unexpected, I was like, all right, I have to cut back. So really that caffeine intake is most important, or the limiting of the caffeine intake is most important in that first trimester. Most literature says keep it under 200 milligrams. Some literature says 300. But again, it's that first trimester because there is some literature to support that it can increase your risk of a miscarriage. And so we all want to avoid that. Again, going through that personally, it is not fun. It's very traumatizing.
So people know, Jenna, somewhere around 100 milligrams per cup of coffee, right?
Yes. And that being said, because I just said Dunkin', Starbucks, you can look up on anyone's, any of the websites, and it will tell you the exact coffee or latte or whatever, and it will tell you the milligrams that are in there. And so or if you even have a bag, you can just Google the maker and it will tell you. So yeah. So exactly like you're saying, it's around 2 cups of coffee, around a medium, medium normal cup of coffee is what you can have a day. So again, that being said, a lot of times you're just naturally averted to that coffee smell. But again, really want to limit it in the first trimester. And if you want to, you can go a little bit ham when the babies when the babies further develop. So like I might push my limits in like late second and third, but really that first trimester, you really that's the reason behind the limited caffeine intake is the increased risk of miscarriage. So that's like all the first things you think of when obviously you're starting conception. And then just to go over what we talked about last week, SSRIs, again, the ones that are safe are Zoloft and Lexapro, but there are other ones that would safe, and that would involve, a true sit down with I would actually advise against using a primary care physician for this. I know, I don't want to sound overgeneralizing, but a lot of times that's outside of their comfort zone. So you can go to obviously your OB, and they might refer you to a high risk fetal maternal medicine physician, or you can use Perfecting Peds because we have that training and that medical knowledge, what is safe and what's not safe, and really discuss those risk benefits of taking yourself off the medication versus leaving yourself on.
Jenna, I love that you started us from the beginning, which is we're doing it chronologically, right? But you mentioned like someone drinking, right? Someone consuming alcohol previously and then stopping once they realize it. What if someone is smoking marijuana or utilizing CBD products or smoking cigarettes? Like, what are your thoughts on those things? Because those are other ones I've had patients say, like, how do I stop?
Yeah.
Do I need? Yeah.
Right. Nicotine, I feel like, obviously, like, again, this is risk benefit. If you can go cold turkey, then of course you want to. But sometimes you're literally probably increasing your risk of miscarriage by the amount you're withdrawing. So it's ideal not to, but then I always think real world, like to have somebody like put on a patch and wean themselves versus, stopping and getting sick, or just saying, screw it, I'm getting so sick, and continuing to smoke. So we definitely do not want that. So if, you cannot stop cold turkey, then you can wean yourself on a patch or the gum because, you want to do it as fast as possible. But like I said, you don't want to increase your chances of relapsing, right? So that being said, THC, CBD, and even I do see a lot of illicit drug use just in the area. And you just want to be, you obviously, if the best way is to be in a clinic with Suboxone and methadone and being monitored. So it's not like people shouldn't be shaming you when you go and ask for help. Like I said, I see it quite frequently, and we want you in a controlled monitor setting with like in an actual clinic with methadone or Suboxone. We know they're safe in pregnancy. We know, how to ensure that the patient isn't getting sick. So I think the take-home messages is that mom's just as important to the fetus, and you just have to find the right healthcare providers to really manage complex things like that and help you, not avoid getting sick, but also avoid relapsing. And so there are safe alternatives like methadone, Suboxone, if obviously you're struggling with an addiction. CBD and THC, historically people would say you can't get addicted, but we know that that's definitely not the case. And those things, I have a hunch that maybe CBD in the future will be considered pregnancy safe, but we don't know, right? We don't know what we don't know. And so I can't encourage a mom to continue to use CBD while pregnant if we don't have any literature on it, right? So if we don't know that it's safe. And I know more and more as it gains more popularity, I'm hoping that we can increase the safety of these medications by doing actual studies, because there is a lot of awesome utility for disease state management. But again, with lack of literature, I can't say, continue to use them. There is something called like hyperemesis cannabidiol syndrome, which you can actually just have like refractory vomiting when you are traditionally used to high doses of CBD or cannabidiol for long periods of time. And it's actually, interestingly enough, not not effective to use your traditional antiemetics. So that's something, again, that if that happens, you would want to go to a high risk fetal maternal, obviously a hospital, and they can help manage that, because there's medications that we can use to minimize the symptoms and get patients through while safely monitored in the hospital. But I think, like you're saying, it's really being forthcoming and upfront about, like, and the risk versus benefit of course, we want you to come off cold turkey. If that's not the case, we do have alternatives to make sure that not only mom but the fetus are safe. And I think that's really a great place to end here. For the next couple of shows, I want to go into, that first trimester. I'm nauseous and vomiting. I always get those text messages where people are like, do not tell anybody I'm pregnant. What can I do for this nausea and vomiting? So we'll go into that. I get a lot of like hyperemesis syndrome, so we can talk about that. And then really your common disease states. Constipation is a huge one in pregnant. What can I use that's safe? And reflux. And so we're going to chronologically go through different disease states while pregnant and discuss the safety of them, and really my FAQs that I get from pregnant women. Again, because there are a lot of medications that aren't safe. And I think the most biggest misconception, is that, I have to be organic and not take anything and suffer as a mom to be a good mom and a good, pregnant patient, OB patient. And that's not necessarily true. Sometimes that actually puts the mom at more risk. So looking forward to covering those topics.
No, I think that's fantastic. I love the ones you covered right off the bat of like, oh no, I just found out I'm pregnant. What do I need to stop now that can be, problematic for my child and myself? And I also love that we found that list because that's one thing that when you are pregnant and you just realize you're pregnant, it may be likely that you go to Dr. Google and look for something and be able to find highly viable, trustworthy information is great. Jen is putting a package together for that, for all those patients out there. And then also on RPH Ally, she's got a lot of good information there that she can share with you when it comes to all the pharmacists and healthcare providers. So we will see you guys next time on the Perfecting Peds Show. Thanks so much. And you guys have a wonderful day.
Thank you.